Hello, I'm Bruce Spurlock, a physician and healthcare leader committed to helping professionals and decision makers navigate change with clarity. On Viral Healthcare, we examine the ideas spreading throughout healthcare and how to implement them wisely and sustainably. On today's episode, we're doing a reflection on the topic we talked about earlier this week. What is it about a healthcare trend or a new idea or a new innovation that sucks you in, that's so tempting, you really need to take advantage of it? What makes something viral in the sense of it's got to be something we do? So we spent some time earlier this week talking about those, and what I'd like to do during these few minutes that we're together is just talk about what you've done about that, what you've thought about those activities, how you may have been trapped based on the ways things are presented or the ways that they are shared with you that make them very exciting, very something that you almost can't refuse. What makes them a shiny object? We talked about some things like the velocity effect. That's when things are going really, really rapidly. When you're adopting a new idea or a new innovation or a trend simply because everybody else is. If they're doing it, it's got to be good. And how you kind of spot that and say, wait a second, I got to step back and say, yeah, maybe these people all want to jump on here, but it's not right for our organization at this time. We talked about the authority effect. That's where the right person, actually somebody with you respect or somebody that you think has some knowledge, tells you exactly what's right for your organization. That authority effect, whether it's a celebrity, an academic institution. Have you seen any of those today? I was at a meeting yesterday in New Mexico where we talked about healthcare with a lot of healthcare leaders all day in Albuquerque. It was really exciting, almost 100 people there talking about ways to improve healthcare. They're all committed, they're all dedicated. And the question I wondered the whole time was what new things they're like abandoning or adopting or experimenting with or even considering, and whether they've really thought through them all the way. Is it because some celebrity, some academic, some expert said that this is something they should be doing? Or is it just because everybody else is doing it, we've got to be doing it too? We talked about this sort of how healthcare things kind of gain momentum over time, and what is it about that momentum that is tempting and really exciting to think about adopting in those. And then we talked a little bit about how you kind of recognize those and step back for a second. How do you think about good decision quality and decision timing? Yeah, this might be the right intervention, the right method, the right process, the right new thing to do. It may not be the right time for your organization. There's a whole host of reasons why that might be. The most important part about looking at all of these things that make this shiny object out there something worth looking at and exploring and maybe even potentially adopting and implementing in your organization is have you really thought it through all the way? And I want to be careful because some people overthink it. They do the analysis paralysis, and we want to be cautious about that. But have you really thought about, is my organization ready? Is the intervention ready? What evidence do I have? Have I seen other organizations that look and act and behave like us do it? Are we in a leadership position to be able to do that? Are we in a financial position to be able to do these kinds of things? What are the barriers that we might be facing? What are the challenges that other organizations have challenged? And how did they break through? And are we able to replicate some of those things? So I hope you've been asking some of these questions of yourself. It's really important to look for different perspectives, to go outside of your organization, to think about people that might have been a little bit ahead of the game from you. That's really kind of exciting when you go out and understand and learn from people and say, I don't want to make their mistakes. If they can share with me what they would avoid doing in the future, maybe I don't have to make those same mistakes along the way. Maybe it's a little bit easier for me. So that's the kind of thing I hope we're talking about in this session today. Viral healthcare really isn't anti-innovation. I want to make that point really clear. We're all about sort of adopting new things when we're ready, when it's ready, and when it really is going to be sustainable. That's really the key. We're going to talk about more of those over the next several weeks, over the next several months. We're going to give real examples about that. But next week, on next week's section, on Tuesday, I'm going to talk about sort of the cost, both obvious and hidden cost related to jumping on too quickly. And sometimes we don't even think about what it means. Sometimes it means long-term pain because the staff don't trust you. It's the flavor of the month. I just want to outlast you because you're going to be gone and I'm going to be here for a lot longer. So we're going to talk about some of those costs next time. Until then, this is Viral Healthcare. We're all about examining the trends and the activities that need to be done before you make a decision to join in that trend or that innovation or that idea. So thanks for listening. I'll see you next time.